Hello, everybody. I am super excited because I'm going to talk to you today about rocking your type 2 diabetes off the charts. Pay close attention. I got so many important things to tell you. And later on, you can go back, replay it, put it on pause. You can watch it as many times as you watch Breaking Bad. Let's start. Here are some of the unmet needs of type 2 diabetes. And I think you'll all agree with me. I don't have type 2 diabetes, but I've been seeing people with type 2 diabetes my whole career. Top of the list, preventing and controlling weight. It's so easy to gain, so hard to lose. There's a high rate of heart disease, and that's why talking about reducing heart disease is so important. It's not just the ABCs anymore, it's the ABCDs. We're going to get into that. And it's difficult to make long-term lifestyle changes. Most people with type 2 diabetes, they get it later in life, and you're already pretty used to your lifestyle habits. It's very tough to change. And adherence to medications, I'll be talking about that quite a bit. It's extremely important. And the emotional burden of living with type 2 diabetes. This is really Bill Polonsky's area, but a lot of the things I'm going to talk about you'll relate to emotionally. So I'm going to go through 8 major things on how you can rock your diabetes off the charts. The first, you need to know that glucose control matters. The bottom line is high glucose levels over the years, not minutes, not days, not weeks, not months, over the years can lead to complications no matter what type of diabetes you have. Eye, kidney, nerve, and heart disease. You've heard that all. Now, when I talk about rock your type 2 diabetes off the chart, I'm talking about the A1C chart, and the lower the better. So the goal for most people is 7%. That means your average blood sugar is about 154. Now, you can't drive yourself crazy trying to get to below 7. It's tough to do. And my own personal feeling is if you can get below 7.5, you're going to be in a pretty safe zone. You can see that A1C of 9 is an average blood sugar of 217, and 13 to 14% A1C, your blood sugar is going to be averaging over 300. Believe it or not, I see patients like that every day in clinic. Type 2 diabetes is tough. And remember, no medication alive is going to work unless you do some realistic lifestyle changes. And remember, it's not a sprint, it's a marathon. Now, this is an important slide. All 3 of these people with the different curves throughout the 24-hour day, they have the same A1C of 7%. That black line, you can see extremely high, extremely low, and the other curves are somewhere in between. Remember that the A1C just represents an average blood sugar. You could have blood sugars all over the place and have a pretty good A1C. This is an important point because we're going to talk about the value of continuous glucose monitoring. These 2 glucose monitors, the Dexcom G6, the Libre 2, they're the most popular. Use them all the time in people with type 2 diabetes. Currently, they're only officially approved for people with type 2 on 3 injections a day. But trust me, this is going to be the standard of care for everybody with type 2, from those who have initially diagnosed or prediabetes, all the way to those on multiple daily injections or a pump. And these 2 glucose monitors, these continuous glucose monitors, no pricks. You don't have to prick your finger anymore. And as a caregiver, how many times my patients come in with type 2 and they say, "Oh, doctor, I forgot to bring in my glucose values." You know what? I understand. No one likes to prick their fingers. Now, just to give you a heads up, there's a implantable CGM where they put this little sensor under your skin. It stays there for 6 months. And you don't have to worry about, sensors falling off and things like that. It'll be available, hopefully, the 3rd quarter of this year, but it's not approved by the FDA yet. Now, I'm just going to give you one snapshot of an example of how wearing a CGM could really help find out what the biggest issue is with your diabetes, preventing you from getting your A1C to goal. You can see where that arrow is. That's when this patient has dinner. And these numbers are basically 2 weeks of numbers. The dark line is the average. The shaded area is the variability depending on the day. But one thing that's pretty consistent, this guy does pretty good all the time, except at dinner time. And he's already on oral medications and a long-acting basal, so we gave him a shot of fast-acting insulin right at dinner. We titrated the dose and just flattened out that post-dinner curve. So these CGM values not only help you see what your blood sugars are at any time during the day, depending on what you're eating, you're not eating, but it also helps make long-term therapeutic adjustments. Now, when you get a CGM, you get a very important measurement called time in range. This is extremely popular now and really in fashion with type 1 diabetes because most type 1s are wearing a CGM. And time in range represents the percent of time that your blood sugars are between 70 and 180. And that includes pre-meal, post-meal blood sugars. That's the ideal range. And when you wear a CGM, it'll tell you you've been 70% time in range. And that's the goal, 70% or greater. Obviously, there's time below range and time above range. But this is an important concept because this takes into account highs and lows, something the A1C does not. Okay, so summarize the second major point. Rock your type 2 diabetes with a CGM. Trust me on this. You should go online. A lot of the CGM companies are giving free trials. Do anything you can to get a CGM. It'll change your life forever. So important. Now, this is a doctor slide, but what this slide shows is the percent of people in the United States who have an A1C at goal, less than 7%. You can see on the left, 2003, on the right, 2011 to 2014. It's only about 50%, and it hasn't been getting better. No change in the last decade, despite, well, you see what the title of the slide says? Over 45 new medications approved for people with type 2 diabetes. How could that be? In fact, the medications I'm going to talk about that protect your heart and your kidney, as well as improve your blood sugar, they have not made a dent in the percent of people at goal. What's going on here? So this is one of the major reasons. It's poor adherence with type 2 medications. Yes, that's all of you. And many of you are not taking your medications as prescribed. And there's a lot of reasons for that. We'll talk a little bit about that. But that's one of the biggest problems in type 2 diabetes, believe it or not. And you know who you are. So I'm looking right at you, by the way. Remember that prescriptions are not always filled, taken properly, or refilled as directed. Now, you're going to be shocked by this data. It's recent data. It's based on what we call administrative claims data, meaning that, when you're in a big healthcare system, we can collect tons of data, not on you as an individual, but as a group. So, believe it or not, out of 100 prescriptions written, I know this is going to shock you, only 50 to 70% ever make it to the pharmacy. What does that mean? People don't get it filled. They don't bring their prescription. Only 48 to 66% leave the pharmacy going to the person with type 2 diabetes. Then 25 to 30% are taken properly. That's only a third. And lastly, only 15 to 20% are refilled. Can you imagine that? This is why we haven't seen a drop in A1C in this country in over 15 years now. You can have the best medications in the world, but guess what? They don't seem to work unless you take them. So here are some of the reasons, and I think you can relate to those. Living with type 2 diabetes is hard. I have type 1 diabetes myself, but as I said earlier, I have a lot of empathy for folks with type 2. They have to do a lot of stuff to get their diabetes under control. It's difficult to take the meds regularly. These meds cost a lot, even if you have a copay. Some of these copays are high. And I've heard this from many of my patients. Sometimes you don't feel any different whether you take your medications or not. So I know people with A1Cs 8, 9, 10, 11%, they say they don't feel any different. And that's tough, because if you don't feel any different, then you may not be motivated to get under good control. Side effects are scary, and you often feel like you're failing. And your ex-wife is not helping this situation either, or your relatives or your kids. They say, Dad, come on, you're not eating right. You're not taking care of your diabetes. So remember, point number 3, I got 8. Having a good attitude about what you need to do for your diabetes is priceless. I'm going to talk about medications later, and one of my closing statements will be, you need to embrace your medications. And if you have questions about your medication, if you're concerned, have a conversation. That's so key. I tell doctors all the time, ask your patients when you prescribe a drug, gee, Mrs. Jones, are you concerned about this medication? Are you concerned about the side effect? Let's talk about it, because there is a lot of misconceptions out there. Okay, let's talk about food. I love this quote. I can smell food and gain weight. And why is it so hard for people with type 2 diabetes to lose weight? This is a true problem. And I want to throw you a couple other quotes that my patients have said. Diet is a 4-letter word. I love that one. And this one patient said, I don't like the first 3 letters in diet. And so there's a lot of pushback. And I think a lot of my patients say, hey, I offer to see a dietitian. They don't want to, because they know what to do. It's just hard doing it. So this is an important slide. This is a person with type 2 diabetes standing sideways, and you can see that he has a big abdominal pannus. And that's what we call central obesity or abdominal obesity. And this is the type of weight someone with type 2 diabetes gains, and it's in the genes. You inherited this gene to gain weight in that area. And it's a very particular type of fat. It's a visceral, intra-abdominal fat. I'm not going to get too doctory on you, but the bottom line is it's the waist to hip ratio. We call that the apple shape versus the pear shape, where most of the weight is in your hips. This weight is related to all the issues we see in diabetes, cardiovascular risk factors, and it's extremely hard to lose. Extremely. This person goes on a diet, what's going to happen? Their arms and legs are going to get skinny, because that's the fat they lose with caloric restriction. So a lot of times you can't get rid of this abdominal bulge. And I know it's frustrating for sure, but this is the type of obesity, and this is why 90% of patients with type 2 diabetes are overweight. 90. It's because it's in the genes. And it's not just because people gain weight through the years. A lot of people blame themselves. I gained a bunch of weight. I gave myself diabetes. That's not true. Now, gaining a bunch of weight is going to make the situation worse. But nonetheless, a lot of patients and their family members blame them for getting diabetes. I can tell you there's a lot of heavy people in the world that do not have diabetes. Okay, let's talk about diet some more. There's no such thing as a diabetic diet. There's no magic diets or diet pills. Please don't fall for that crap on television. There's no shortcuts. Weight loss is difficult, and make small changes slowly. And here's the key. Eat the foods you like, but in moderation. Portion control. You like a big juicy cheeseburger? For God's sake, have one for this size once a month. But don't deprive yourself of things that you like, that you were brought up with. Just be cautious on the portion size, and over time improve some of the nutrients that you put in your diet. Okay, I want to suggest trying a low-carb diet. Now, low-carb diets are hard to follow. And, you've heard of the keto diet, right? But one thing that I want to point out is that if you stick to low carbs, your blood sugars will be better. And it doesn't have to be 100% no carbs. It could be just reduction in carbs. And you see that last bullet point? It may help get you back on track with your blood sugars, and then you can slowly introduce carbs as you go on. Now, this is a picture on my kitchen counter of low-carb stuff. This PB, this powdered peanut butter at Costco, you mix it with water. You can dip celery sticks in there, cauliflower rice, beef jerky, crackers that are made out of cheese, nuts. Don't eat too many because they're fattening, but they definitely help to curb your appetite. And I think one of the biggest tricks that I've used is egg beaters. Most of the calories in an egg is in the egg yolk. This is egg whites. It kind of looks like there's yolk in there, but food coloring. I love chemicals. And you can make the awesome omelets. This is my chicken maple sausage omelet. The recipe is on our website. That whole plate is extremely low calories, like not more than 200 with no carbs. Then we get the tacos. I call them time and range tacos because it helps improve your time and range. You just get rid of the taco shell. You get some crisp lettuce, and I made turkey meat, which is less calories than regular meat, and a ton of seasoning. And Edelman's big ass salad. Go to Costco, buy all the stuff. I make a huge vat of salad. I put it in different containers, and I have it throughout the week. And the only thing that's full of calories is salad dressing. Smoked sesame is my favorite, and it's mostly fat. So it's a relatively low carb, meal. And sometimes I'll put a piece of salmon on top. So you have to try to eat the food you like in moderation and avoid the carbs. Now, what about supplements? How many of you have heard that, cinnamon is good for people with diabetes? Be careful of supplements. I mean, I heard I've been eating 3 Cinnabons a day. It hasn't helped my blood sugars at all. I wish I could hear you laughing at home on your computer. Please don't spit on the screen. You might have to clean it off later. Look at the sugar in regular foods. Just pay attention to the food label. You got to go with diet drinks. Please don't drink regular soda, please. Abbott Nutrition, they put out Glucerna, the Glucerna bars and the liquid, the shakes. They're very good. Why? Everything's on the label. It has the number of calories. The shake has a lot of protein, and it can help you curb your appetite. And I don't mind supplements like this, if you want to call this a meal supplement, because everything is upfront and they tell you exactly what's in the product. So 4, eat the foods you like in moderation. Okay, I got 9.5 minutes to go through 5 through 8. Here we go. Let's talk about exercise. Anybody see anything wrong with this picture? No one takes the stairs anymore. I've been guilty of it. This is the Frankfurt airport. If you're carrying suitcases, different story. But you can get a lot of exercise, believe it or not. Walking throughout the day, taking stairs, and you could use your little app, your health app on your iPhone, keep track of that for you. Give yourself kudos. This is the Sweden subway station. You can see that they paint little pictures and they encourage people to take the steps. This is a real picture, by the way. Now, let's talk about exercise, how it can be embarrassing. There's Jeremy Pettis. You know him. He's the rock star, the great speaker. Him and Eric are going to rock you out today, and you've already heard that. But he was dating his wife now. They weren't married this time. Watch him as he shows off. And he was more embarrassed when he got flipped over and she saw what was on the other side. Sorry, Jeremy. And the bottom line is, do whatever you enjoy. And it doesn't matter what it is. Remember, you can exercise at any age. This is my grandmother, Lucy. She started walking 5 miles a day when she was 60 years old. Now she's 100. And we don't know where the hell she is. 5, exercise makes up for mistake. I love that quote. You got to do whatever you enjoy. Okay, type 2 diabetes. There's Tom Hanks. Type 2s make up 90% of the people with diabetes in the world. They're usually heavy in the abdominal area, as we talked about, usually diagnosed after 35, but not always. The cause is very complicated: insulin resistance, other defects, much higher in ethnic groups like African Americans, Asian folks, Native American Indians, Latinos. So we don't know why. It's in the genes. and type 2 diabetes associated with high blood pressure, abnormal cholesterol, and heart disease. So when treating diabetes, you can't just think of blood sugars. You've got to think of protecting the heart and the kidneys as we go through. That's why we talk about A, B, C, D. What is D? Medications that protect the heart and the kidney. So important. And of course, can never leave out the realistic lifestyle modification. No drug's going to protect you if you eat anything you want at any time and you're overweight and you don't exercise. We have a huge diabetes toolbox now. The two I want to talk to you about briefly, the GLP-1 receptor agonists and the SGLT2 inhibitors, protect your heart and your kidneys, and they help with weight loss. Let's talk about the GLP-1 receptor agonist first. Now, I'm not going to spend too much time on these because Dr. Tricia Santos is going to go over these in detail as well. Now, the GLP-1 is a hormone that comes from the gut. And when you eat, it gets released. It goes to the pancreas and stimulates insulin release. It also slows down the peristaltic motion of your stomach so that your blood sugar doesn't rise real fast when those nutrients get absorbed in the bloodstream. It decreases the amount of glucagon and glucose made by the liver. That's important. And very importantly, in the upper right, it reduces your appetite. And that's why weight loss is seen with these drugs. Now, they started off where you had to give it twice a day. Then it was once a day. You see Bydureon, Trulicity, Ozempic, they're once weekly. And they even have an oral medication now that you take once a day. And I started a patient on a once weekly GLP-1 yesterday. And she goes, wow, only once a week? And it is kind of amazing. But these drugs, they lower your A1C. They help you lose weight. They do not cause hypoglycemia at all. Even though they stimulate your pancreas to secrete insulin, it's really a physiologic amount. And they protect your heart from heart attacks and strokes. Remember, GLP-1s, heart attacks and strokes. They come in combination with basal insulin, which is really nice. And you're going to have to learn more about them through Dr. Santos's lecture and our website on the resource page if you don't have the best insurance. Okay, let's talk about SGLT2s. Remember, SGLT2s help reduce congestive heart failure, one of the most prominent cardiac problems in people with type 2 diabetes, and help protect against the progression of diabetic kidney disease, another super common complication. There's 4 of them. Ready for this? Farxiga, Invokana, Jardiance, and Steglatro. You're lucky I'm not saying the chemical name. And they're all fairly similar, but they all have some differences. But it's good to know we have choices. How do they work? I'm going to make it really simple. They help your body pee out excess glucose in the blood into the urine. So it causes your urine to be full of sugar. Not so much where you see it. It's just helping you get rid of excess sugar by peeing it out. And you see the glucose levels in this guy's hand. That's how much a normal person would pee out. It's a lot. So let's talk about the benefits. It's going to sound a lot like the GLP-1s. Lowers A1C, so it's good for your A1C. Weight loss, improves blood pressure, does not cause hypoglycemia, and protects your heart, protects your kidneys. And remember, each SGLT2 is a little different. It calls for a conversation with your healthcare provider. So 6, got 2 more. GLP-1s and SGLT2s are 2 of the most important drugs for all of you folks with type 2 diabetes. Ask yourself these questions. Are you at risk or do you have heart disease? Do you have diabetic kidney disease? Are you overweight or obese? Are you at risk for hypoglycemia? And I think the areas of importance go from the top to the bottom, especially those top 2 bullet points. Okay, I thought I'd mention inhaled insulin. A lot of people don't know about it. It's called Afrezza because one of the issues with adherence and persistence is with people who have to take mealtime insulin. So this insulin is easy to take. And we have 2 new faster acting insulin analogs as well, and 2 excellent new basal insulins for those of you that need insulin, TCOYD and Tresiba. Once again, I didn't want to go into detail for the sake of time, but I just want to let you know we have lots of new stuff. But once again, you have to find the right drug for yourself, get access to it, and then take it. And don't stop it prematurely because you read something in Reader's Digest, please. So, insulin pumps, we use them for people with type 2 diabetes as well. There's the Tandem and the Omnipod right there, and there are others coming on down the line. And anybody on insulin needs to have a glucagon kit. These are the 2 new ones, easy to give. One's a nasal inhaler, Baqsimi, and the other is kind of like an EpiPen called Gvoke. Anybody on insulin needs to have these around in case you get so low you're unable to help yourself. So 7, embrace your medications. Ask questions if you're concerned. Okay, if you cannot prevent a complication, early detection is the key. So with aggressive treatment, early on you can halt or slow the progression of eye, kidney, nerve, and heart disease. But you got to pick it up early. That's why we talk about the diabetes warranty program. I have a whole lecture on that that's going to come later, but it pertains to your eyes, kidneys, nerves, heart, believe it or not, teeth and gums. So there's a whole set of lab tests and exams you should get every year to make sure that if you're going to develop a complication, you're the first to know, your caregiver is the first to know, and then you can get to the specialist. So my last couple slides, this is a t-shirt by Bill Polonsky's group, Behavioral Diabetes Institute. He says, well-managed diabetes is the leading cause of, you turn the shirt around, you know what it says? Nothing. It's pretty boring. You take care of yourself, there's nothing to talk about. So last one, 8, get type 2 diabetes, control it, and live longer because of it. And my last slide here is to remind you that we now have a TCOYD video vault. And we have all the lectures we've done on the several virtual programs, type 1, type 2, a lot of great stuff on there. And this one will be on there as well. So long, rock out, man.